SPF stands for sun protection factor, which makes it a pretty descriptive term because it's the factor by which the time it takes for you to get a sunburn is multiplied when you use a given product. And the US FDA even requires that this is measured using in vivo tests on human participants. But don't worry, this doesn't mean that sunscreen companies have to go around giving human subjects massive sunburns on the regular. The FDA only requires that a series of very small test sites are used on a subject's back. A series of increasing UV doses is administered to a set of subsites on each patient's backs, with one set each for unprotected skin, skin treated with the sunscreen being tested, and skin treated with a sort of standard made of predefined sunscreen ingredients to serve as a control. An individual SPF value is calculated for each subject by taking the quotient of the minimum UV doses that cause sunburn with and then without the product. The SPF value that can actually go on the product's label is a sort of lowball average, calculated by taking the average of the SPF values for all of the subjects and then subtracting a multiple of the standard error, which is a defined value that gets smaller the more test subjects you have. This encourages the developer of a product to get accurate SPF readings by using lots of test subjects. Lastly, the standard comes into play as a control. An SPF test is only valid if the calculated value for the control is close enough to a set value. But measuring skin redness as they do in these in vivo tests is subjective, and using human test subjects is expensive. So mathematical alternatives exist, in which the absorbance or transmittance of sunscreen applied to a thin membrane is measured. To get an SPF value, you basically look at how effectively EM radiation across the UV spectrum is absorbed, with different wavelengths being weighted to account for how much they contribute to skin redness and how present they are in the sun's radiation. But to put an SPF value on a label, you still have to carry out an in vivo test on humans.